In today's video, I'm going to talk to you about the differences between lateral hip pain, which is essentially a muscular hip issue, and hip osteoarthritis, which is a hip joint issue. They are two completely different conditions with completely different symptoms and subsequently completely different treatment options, but they are often misdiagnosed. So I am going to talk you through what you need to know so that you can work it out from the comfort of your own home. Now, the reason I wanted to do this video for you today is because I have seen 3 ladies this week who have all had the same misdiagnosis and for exactly the same reason. Now, what happened was they all had hip pain. They went to their doctor to seek help, which is understandable, and their doctor referred them for an x-ray. Now, we know that if you have an x-ray on particularly knees and hips over the age of 50, it's highly probable to come back with some age-related change or osteoarthritis, whether you have pain in the affected joint or whether you have no pain whatsoever. So surprise, surprise, these x-rays came back and they showed some arthritis. The GP told these ladies they had hip osteoarthritis and they were then referred to me. The key thing is, does the x-ray correlate with the symptoms? Does this correlate with a presentation of hip osteoarthritis, or could it be something else? Well, that's what we're going to talk about next. After we went through a really thorough history of these ladies telling me exactly what was wrong, where their pain was, what sort of things affected their pain, and we did the physical examination, it was quite clear that they had no issues with their joint whatsoever. There was no stiffness, no reduced range of movement, and all of the symptoms that they were complaining of were symptoms that correlated with lateral hip pain. Now, we mentioned earlier that there are 2 different conditions with different symptoms that have different treatment options. So it's really important that if you have hip pain, you get the right diagnosis at the beginning. So let's talk about some of the symptoms that you would expect with this lateral hip pain diagnosis. So the first thing to say is it's exceptionally common in sort of peri and postmenopausal women. Your hormones have a significant role to play in soft tissue health and bone health, but definitely soft tissue health and tendons. So these tendons that attach onto the outside of the hip are susceptible to pain and inflammation and irritation when these estrogen, progesterone and testosterone levels start to drop. Now, I'm about to state the obvious, but lateral hip pain tends to be on the outside of the hip. It tends not to cause groin pain, it tends not to cause front of thigh and inside of thigh pain. It can refer slightly down into the outside of the thigh, and it can refer a bit round into the buttock. The other thing that you may find is that it's tender directly on the lateral hip. So where that area of inflammation is, it doesn't like being touched, and if you palpate in there and have a push yourself, you may find that it's sore and tender to palpate. Because of this, one common thing that you probably won't like is sleeping on the affected side. So this lateral hip pain does not like being compressed, and it doesn't like being stretched. So activities that are likely to cause compression are going to be anything where you have direct contact on that side. So I don't know, maybe sitting in a very narrow chair, but most commonly people will not like sleeping on that side at night. You may also find that you don't like sleeping on the opposite side, and that is because the leg then crosses the midline slightly, and that can put a stretch on the outside of the thigh. And one thing that we commonly suggest to try and negate this is sleeping with a pillow in between your legs. Takes the leg out of midline and just in a slightly more comfortable position, so there's less stretch on the lateral hip. One of the other theories about why lateral hip pain may develop is because of weakness, deconditioning or overload. So we think there's inflammation there because those tendons are struggling to tolerate the amount of load that you're putting through them, and therefore activities that load the lateral hip could make symptoms worse. So prolonged walking, stairs, running and other sporting activities. So if we move on to symptoms associated with hip arthritis, the location of pain is different. So typically people with hip arthritis and joint pain, they will complain of pain in the front of the hip. So they feel like the pain is in the groin, it feels deep, like they can't really get to it, and it can cause referral down into the thigh. So this kind of outside of hip pain versus groin pain is one area that might help us differentiate between the two. Stiffness or reduced range of movement is a common symptom associated with joint symptoms. So you may find that if you have hip osteoarthritis, you have 30 minutes or less of stiffness first thing in the morning, or after you have been in one position, sat down for a while, you get up, first few steps are a bit stiff, you warm up, you get moving, and then symptoms ease off. You may find that there is just no longer the same amount of movement that you had in the hip as you did a few years ago. So you may find it difficult to put shoes and socks on because the hip just feels restricted. You may find that you can't bring your knee up all the way to your chest anymore. Restriction and reduced range of movement is not generally something that we associate with lateral hip pain. It may be pain limited movement, but it's not because of a restriction within the joint. We did discuss some of the activities like walking and running that could be sore if you have lateral hip pain. Unfortunately, there is a little bit of crossover here with regards to your hip joint. Your hip joint is a weight-bearing joint, and therefore activities that involved prolonged weight bearing could be uncomfortable. But then for me, it comes back to where are the symptoms, what are they? If you are walking for half an hour and you only get pain on the outside of your hip, whereas you walk for half an hour and you get groin pain, again, we're consistently trying to build up this picture of what is it more likely to be. So they are the key differences between lateral hip pain, which is a soft tissue issue, and hip osteoarthritis, which is a very different joint issue. Now, I'm going to caveat everything I've said with you can have both at the same time. So one situation that I see quite commonly is that you may have developed some hip joint pain that has caused your walking to change. You may be limping, and this causes overload to the lateral hip, and then you subsequently go on to develop lateral hip pain as well. But a thorough history from you and a good quality physical examination from somebody that knows how to should be able to conclude whether you have one, either, or both. Now, that is very important because without a diagnosis, it's very unlikely that the treatment is likely to work, or it's just less likely to work. I really hope you found today's video helpful. If you did and you would like some more free help, you can find a completely free osteoarthritis ebook in the description below the video. If you would like some help with exercises for your hip pain, you can find loads of workouts on the Genuine Physio YouTube channel. Please do subscribe to the channel so you don't miss any videos, but also so more people find the video that you found helpful. Whilst you're down there, please do like it as well to show your appreciation. And whilst you're doing those lovely things, I will see you in the next one.